guess, I think I have Elmore on the Rehab Power Hour. Elmore, can you hear me?
Yes, sir.
Hey, Elmore, how are you doing today?
I'm doing good.
Very good. That's great to hear. Would you mind if you started by telling me who you are and where you're calling from?
Well, my name is Elmore Dunn, and I'm from Rocky Mount, North Carolina, and I'm 53. I'm 55 years of age, and I had a stroke in um, 2019, December 17th to be exact, in 2019. So,
Okay.
of course, I was at work. I worked for UPS for 20 years. Um, and suddenly it happened. I stroke. So I wish I was in Craig's position because I can't speak that well because it affected my speech. It affected my whole right side, my speech, my arm, and my leg. Um, but I can't walk a little bit on this leg now. I'm driving. Um,
Great.
I do a lot of things. I learned to put on my clothes. I learned to brush my teeth, shave, eat. Um, I can still do everything with my left hand, but my dominant hand is my right hand. So the question I have is, I'm like Craig. The question is, will it work?
Everyone asks me this. Well, not everyone asks me this. Of course, absolutes are never true, right? But
Yeah.
very many people ask me this question, and
Oh yeah.
I will be nothing if consistent. And unfortunately, I'm not going to be able to say that any individual person is going to have this amount of improvement or this type of progress. I think
Okay.
when we look at it, generally speaking, we see those types of improvements that I described. Now, that being said, there are a number of factors, those that we can measure and those that we don't know anything about, that matter a lot when it comes to sort of predicting, if you will, how good of a response you're going to have. One of those is sort of your baseline function after stroke. How much movement capabilities do you have? How responsive were you to initial intervention, right? How far along are you from your stroke? Now, all of those things can also interact with each other and can get really complex. But I think one thing that you're describing is that you're also exceptionally motivated. You're making progress. You're able to integrate, these ADLs back in your daily life, and you're able to do a lot of things independently now. So showing me that you're really motivated, you're really invested, and you are still making progress, which is great. Those things are real good kind of check marks on the plus side, if you will. So those things are really positive. Now, the extent to which those things are going to help give me some higher degree of precision, it's going to be very, very hard for me to say that for certain. Yeah. But I think, based on what you're describing, it sounds like something like this could help. But again, it's a matter of, this is one of the reasons why we actually have designed the system in a way such that people can use it iteratively, right? They can use it, and because we give them access to the data, because they are able to see objectively what their progress is, people can then are empowered to make their own decisions and opt in and say, yes, I want to continue. I'm seeing progress. Let's keep going. And then what the other side of that, the other side of that coin is, we will have clarity and transparency in when there isn't progress, right? We'll be able to ask rather difficult questions when you think about it. Am I making progress? And the very difficult question is this worthwhile for me to pursue? And then we can have those hard questions about, well, did we do things appropriately, right? Did we work hard enough to really see an actual change? And if not, then let's see what we can do to modify that and test. It's all this idea of, if we don't have the ability to make predictions perfectly, we can always try to do something. We can do an intervention and we can see the outcome, right? It's this test and response phenomenon where you can test and see the response. And the recommendation generally is, as soon as we continue to see, or as long as we continue to see progress, we have a strong justification for continuing. And this process is very hard to do in classic rehab, mainly because a couple of reasons I was talking about with Craig is the periods that we have to do rehab are very short. We also don't have that much time to do assessments. And oftentimes the doses, the amount of active therapy that we're getting is also suboptimal. And again, those are not critiques on PT themselves. It's more of a critique of the whole system. And so systems like this allow us to make those more objective evaluations in maybe an easier way. And so that would be kind of my high level thoughts about this. I'm happy to go into any details. And I know you guys probably don't want me to go into any more details because it could get ugly in a hurry. But I'm actually going to ask Dr. Wolf if he has any sort of comments on this as well.
I really enjoyed listening to what you were saying, Elmore. And the big operative word in your concern is work. Will it work? Mm-hmm. And we need to define, each of us, what we mean by work. There's no magic here. There's nothing that happens suddenly. The progress, as Dr. Housley is referring to, is progressive, and they're in small steps. And one way we sometimes try to encourage our patients to think about these things is to ask themselves a very simple question for the immediate future. What is it that I'm able to do now that I couldn't do yesterday? It could be very, very small progress. But you know, a series of those small progresses lead towards something that is functionally recognizable. And so to think in terms of working, one needs to think in terms of progressions and to be undergoing some training that enables you to see what some of those progressions are. And then you can make the decision for yourself. How much is this working for me? Am I going in the right direction? And the big honest phrase to me is, what is it that I can do today that I couldn't do yesterday? Even if it means now being able to pick up my right arm and bring it to my face in a way I couldn't do before. And I'm just throwing out an example. Or being able to move my fingertips from a table up towards my shoulder without having to lift my whole hand up. There are ways in which we look for these things and then try to build upon them. There's no magic bullet where suddenly everything works right away. It goes in very, very small, deliberate, and hopefully successful steps.
So let me ask you a question. What's the time limit that's set on and for improvement? When do you notice some time improvement? And once you start using the robot, what is the? I mean, it's 2 months, 3 months, 4. I mean, how long will you notice improvements after using the Motus Nova?
Yeah. So in terms, I think what you're asking, and maybe I want to clarify what you exactly mean, Elmore. Are you talking about the persistence of the effects, or are you asking how long it will take for you to observe an effect?
How long will it take to observe any effects?
Okay. So again, I think that's very similar to what we were describing earlier. That sort of, if you imagine that your function is here, right? Whenever we can detect a change, something going up or going down, both ways, right? We don't know when that inflection point's going to happen, right? Okay. Now, the honest answer to your question though is, maybe I can rephrase it. When would we know that we're maybe not going to see an improvement, right? Maybe that's a different way of describing it. And I think if we were to go kind of full force at something and we didn't see improvements in the course of a couple of months, I think we would maybe draw into question whether or not this specific approach would be best for you. And then again, there's a heavy asterisk there that says we're doing it optimally. And there's a question about whether or not we can do it optimally, or we know what optimal is. But let's say if we went at this and we were doing multiple hours a day and, fully engaged, really driving at it, and we were not really seeing meaningful progress in those timeframes, we would question whether or not this was a good approach for you specifically, I think.
Okay.
Yeah. Okay. Dr. Wolf, any other thoughts on that topic?
Absolutely. I can't help but wonder, since I've noticed something, Elmore, you're a guy who likes to gesture while you talk, right? You like to move your hand. Are you able to move your right arm at all?
Well,
Okay, so here's what I want you. Do you mind if we do a little something? And I'm really going out on a limb here.
Okay.
I want you to do me a favor.
What?
I want you to sit on your left hand. And I know it's hard to talk, and you've come a long way in improving your talking, but if you're going to, as you engage now in a conversation with Dr. Housley, do you mind sitting on your left hand and seeing
Okay.
if you do any gesturing at all with your right
Oh,
hand?
okay. Oh, yeah. Okay.
Mhm.
Okay. Well, it's kind of hard to do.
I understand.
Yeah.
I understand. Keep on going. Just keep on talking.
Yeah.
Okay. Okay. So it's very difficult to do. Like,
Mhm.
whoo, it's tough. It's tough.
Yeah.
I know what you're talking about, but it's a very difficult test. I mean, it used to be second nature. I mean, you have to think about it. But now
Mhm.
you have to think about moving your hand just because I like to gesture with my hand like I do my left hand. So I like to do a lot of gesturing. So now I don't, I can't, I mean, I wouldn't say I can't move my right hand, but I only move my hand when I'm exercising, doing passive exercising, doing
I want you
push-up.
to sit on your left hand
Okay, okay,
and just think a little bit as you're talking about moving your right wrist and
okay,
fingers. You don't have
okay,
to move your whole arm. Just try. I may
okay.
not, we may not be able to see you, but
Yeah,
that's
okay,
okay.
And it
okay,
can be something as small as just like, moving just little hand gestures, little
Even if
hand.
it's
okay,
a little bit
Yeah.
of,
okay,
even if it's a little bit of this,
Yeah. Yeah.
just keep on talking.
okay. So
Well, yeah. Well, Elmer, tell me this. So you were working for UPS, right?
yes, sir.
Uh,
20 years,
yeah.
and check this out too. Um, I was a painter. I was a painter for 28 years. I painted
Okay.
houses and then now this is the kicker. I used to play the keyboards. I mean the piano for 35 years. I played with a group, so I can't play the piano like I used to with two hands. So
Hmm.
I play with one hand now. So it's kind of difficult to play with one hand, but my dominant hand is my right hand. So
Yeah.
I lost a lot of things because of this stroke. So that's why I'm trying to at least get back. If it ain't but 80%, let me get something back. So those just don't take my right hand or my right side and be gone for completely. I want to
Mhm.
at least uh, lift things with my hand, open the refrigerator, um, uh, uh, turn a glass of water to my face with my right hand. I mean, it's just the little things that it means a lot to me.
Hmm.
Hey, Elmore,
Yeah.
while you were talking now, I counted 12 times that you moved your right shoulder.
Hmm.
Are you aware of that?
No.
Yep.
Okay.
So
The
this is
point
something that you
is,
can do, Elmore, when you're just interacting with people, right? It's this idea of trying to integrate your right hand in as much of your day as possible, right? Every
Okay.
little thing you can do. I
Okay.
think it comes down to it takes a conscious effort, like Dr. Wolf was saying, because you will revert to using your left arm, right?
Oh.
Your left arm you will prefer it, but we have to prevent that right arm from just being forgotten effectively.
Okay.
And
Okay.
that's a strategy that Dr. Wolf was doing. He was physically making you sit on your left hand. And what was interesting, you could also see you trying to gesticulate with your left shoulder as well, but your right shoulder was getting into it as well.
Oh.
So
Mm.
these are some little tricks you can do.
Okay.
so I know this, going back to our original conversation, I'm going to guess you have not tried to do that before since your
No.
stroke.
No. No.
So
No.
here's an example of you being able to do something that you didn't do before. It sounds silly and basic, but that's how you start.
Hmm.
Okay. And because I would bet you, as a piano player, a person who's used to using his hands to talk. I know that you must be doing
Right,
that.
right.
I would bet you if I asked you most of the time when you're talking and gesturing, what are you doing with your hands? You probably couldn't tell me. You couldn't tell me unless, look at me, unless you really wanted to make a specific point. And then you could say, well, I'm pointing my finger at you, right? But
Yep,
the
yep.
fact that you can't tell us what you're really doing with your hands when you're gesturing tells us that you don't even need the conscious drive sometimes to make that happen. And I think what Dr. Housey's talking about is just trying to help build those connections again from your brain to your right side. And this is one little way of, it's very silly, at least at first. It might feel a little uncomfortable, perhaps when you're talking with friends or your family. Just get used to sitting on your left hand.
Okay, okay.
And it might seem awkward, but just keep on trying to gesture with your right side.
Okay.
So constantly trying to make those connections. Every little thing helps.
Yep. Another question I have is maybe Craig can understand what I'm talking about. It's called the public enemy. Number one is called spasticity. That's something everybody goes through, I guess, when they have a stroke. So my enemy is spasticity. If I can get that under control, I mean,
Put your left hand down, Elmore.
Oh, okay. With the Motus Nova, would the Motus Nova help with spasticity? That's, I mean, would it help you get rid of the stiffness, the tightness, everything like that?
In the clinical trials that we run and in large implementation studies, we were measuring versions of this. And the answer to the question is, yeah, we do see improvements in passive range of motion and reductions in tone. And what we can do now is we can actually quantify those magnitudes of improvement over time. And we're seeing that those changes can happen reasonably quick as well in some individuals. And so, yeah, these ideas of getting these long, low stretches as well as actively engaged in the activities really driving improvements there. So again, it's going to be hard for me to say specifically that any one individual is going to have XYZ improvements, but generally speaking, the answer to that question is yes.
Okay. Well, sounds good. Sounds good to me. Y'all have answered a lot of questions for me, so maybe next time I have some more questions for you.